All right. In this lesson, we're going to talk about acquired immune deficiency syndrome, or AIDS, or AIDS. So first, I want to clarify the difference between HIV and AIDS. HIV is human immunodeficiency virus. It is a retrovirus. It affects the immune cells in the body, specifically the CD4 cells and those types of lymphocytes. Now, these days with medications, patients can live for decades after diagnosis, and most of them actually live long, happy lives. So we use what's called HAART therapy for HIV, which is highly active antiretroviral therapy. There's multiple drugs. They all fall under the HAART therapy umbrella. And honestly, advances are being made every single year to make HIV less and less of a death sentence. Now, after a while, the body is going to wear out and the patient's immune system can't keep up. That patient is going to develop acquired immune deficiency syndrome, or AIDS. Now, this is a set of symptoms or conditions. That's what a syndrome is. It's a collection of symptoms that indicate that the patient is in the later stages of HIV infection. Within AIDS, we find that there's destruction of the T4 lymphocytes. And so if you remember from like leukemia and lymphoma lessons, lymphocytes are responsible for our immune system. So if the patient has complete destruction of all of their CD4 lymphocytes, then their patient's going to be highly susceptible to infection. And especially what we see are what are called opportunistic infections. So opportunistic infections are ones that healthy patients could easily fight off. This is even simple things like pneumonia or a urinary tract infection could be really, really problematic for these patients. But because they are immune deficient, they're now highly susceptible to even the most simple of viruses and illnesses. Now, the first one that we see that's really specific to AIDS patients is what's called Kaposi's sarcoma. Kaposi's sarcoma is a cancer caused by the HPV virus and it's really a classic sign of end-stage AIDS. So you see these purple raised lesions. They could be on their skin. They could be even in and around their mouth. So these are Kaposi's sarcoma, Kaposi's lesions. The other possible opportunistic infection is candidiasis, or yeast infection. So you'll see white patches, usually in the mouth. They call this thrush. Now, like I said before, AIDS patients are much more susceptible to contracting even normal types of infections, but even tuberculosis is especially common in immunosuppressed patients. So we need to find out if they've been to any high-risk countries, find out whether they've been exposed, and make sure that we're addressing tuberculosis appropriately. Now, there is a tuberculosis lesson in the respiratory course, so please feel free to check that out. And then again, other things they might be at risk for are amoebas, parasites, things that a normal, healthy patient might be able to fight off are going to be a real struggle for AIDS patients. And this is just going to wreak havoc in their body. So we'll see these frequent infections. We'll see possible skin breakdown and ulcers in the mouth. That's what stomatitis is ulcerations in the mouth. But the other thing that we see quite a bit in AIDS patients is what's known as wasting syndrome. So what happens is their body begins to burn basically all of their sub-Q fat for energy because it's not really able to do what it needs to do. The muscles are going to begin to waste away. You're going to see muscle atrophy. And that's what we call wasting syndrome. And they get frail and thin and almost ghostly. They'll have a really poor appetite. They'll have some nausea, vomiting. So we're going to see malnutrition. We're going to see dehydration because of that nausea and vomiting. And then they're going to be weak. They're going to be fatigued. They may even have an increased heart rate. So all of these things, they just really are going to feel awful. We'll see things like with the malnutrition, we'll see their electrolytes out of whack. We'll see vitamin levels out of whack. That's all part of this malnutrition and wasting syndrome. And then, of course, we're going to see their white blood cell count almost completely wiped out. I've seen people with a CD4 count of 0. When we're managing AIDS, we want to make sure to provide respiratory support because we know they could contract respiratory infections like tuberculosis, pneumonia, even the common cold can cause really severe reactions in their lungs. We also want to provide nutritional support. We know they're going to struggle to eat. They're going to be malnourished. They're going to have this wasting syndrome. And so we want to make sure we encourage high quality foods, and we want them to eat small, frequent meals. This helps with, if you're nauseous and you really don't feel good, it's hard to eat a full meal. So if we can have them eating small, frequent meals, choose their absolute favorite foods, things that they actually will enjoy and like eating, is going to make it easier for them to get more calories in. And we can also do things like giving antiemetics right before they eat, just to help them keep their food down. And then, of course, we're going to focus on infection prevention. We're going to use standard precautions, really good hand hygiene, HIV, AIDS, even other infectious diseases like hepatitis C. These are all just standard precautions. If you're using gloves, if you're using needle safety, you're fine. And wash your hands and really protect them from infection as well. And then, of course, monitor any signs of infection. So that might be an increased temperature, might be increased heart rate, and then any outward signs of infection like redness and swelling and things like that. And then we want to encourage the patient to conserve their energy. We're going to cluster our care. We're going to provide rest periods and just help them understand that this is a long road and it could be distressing for the patient and their family. So we want them to conserve as much energy and independence as possible. So like we just talked about, our top priority nursing concepts for a patient with AIDS are going to be infection control and nutrition, but we also want to consider things like coping, end-of-life care, because this is the later stages of infection with HIV. Now, patients have developed an AIDS syndrome and then been able to go back into AIDS remission by getting back on HIV meds and taking care of themselves that way. But again, this is a very serious situation, and it usually does lead closer to an end-of-life scenario. So let's just recap quickly. Acquired immune deficiency syndrome, or AIDS, is a condition that involves a collection of symptoms that indicate the patient, again, is in a late stage of HIV infection. It interferes with the patient's T4 lymphocytes, and it's going to destroy their immune system. This puts them at risk for infection, especially opportunistic ones. These are infections that it's almost like a burglar going in an open door. He didn't really have to work very hard for it. The door was open. He just walked right in. And so that's what opportunistic infections are. They're ones that take advantage of the fact that the patient has a decreased immune system. So this is things like Kaposi sarcoma, candidiasis, tuberculosis, pneumonia. Now, we want to also make sure that we support and protect their respiratory system, provide optimal nutrition, prevent infection, and help them conserve what energy they do have. This is an exhausting and debilitating disease, especially in the later stages. So we want to be there for our patients and give them what they need. So those are the basics of AIDS. Don't miss all the resources we've attached to this lesson, including a care plan, case studies, flashcards, questions, etc. They're all going to help you learn, put the pieces together for these patients. All right, guys, with that said, go out and be your best selves today. And as always, happy nursing.